Good morning, everyone. Today we will talk about ideal dressing technique for a dressing of a wound. Uh, Whenever we are doing a dressing for a patient, first and foremost thing to do is explain to the patient that what and how the dressing is going to be, how painful it is going to be, and then calm the patient and so that patient will be cooperative for the procedure. Once we have explained to the patient, if the patient if the wound is very painful, then give a painkiller to the patient prior to the procedure. Once this is done, we are ready for doing a dressing of the patient. For doing a dressing, we are supposed to use sterilium on our hands, do all the steps of the hand rub, clean your hands, and then wear hand gloves. So 3 scoops of hand rub, spread it completely on your hand up to the forearm, on the both forearms. Then all the steps of hand rubbing technique, fingers, all fingers separately, thumb, interdigital spaces, anteriorly and posteriorly, and then again all the spaces once more. Then we are ready to wear the hand gloves. Once we are ready to wear hand gloves, open the gloves and place it on a plain surface. We are not supposed to open it. Open the gloves. Take the glove in hand and only touch the outer surface of the glove. Once this is done, use the sterile technique while holding it. The inner surface, I can touch the inner surface of the glove with the unsterile portion, and then use the other sterile portion to touch the outer surface of the glove. This is how we have done the gloving. Now we will use a sterile sheet to put under. So we will clean the surface with the betadine. First the center, coming from center to the periphery. Try and clean all the area which was covered under the dressing previously, so that the dirt which was there will be cleaned properly. Try cleaning it. Consider this whole foot as one unit and clean it properly on all the surfaces. Heated. One more time, cleaning the internal part of the wound in detail. Then clean it properly. Spirit. With the spirit, we will be only cleaning the surrounding area, so that it will be completely sterile and it will be easy to apply a micropore on it. Ointment. Once this is done, we will apply betadine ointment on it. We'll try to push inside whatever betadine ointment possible. Apply a adequate amount of gauze. It should not be too much, it should not be too less. Once we apply a gauze, it is going to stay there for 24 to 48 hours. So that much amount of padding the patient should have. After this, if it is too much, it will be uncomfortable to the patient, and if it is too less, the dressing will become soaked, and then we will apply a micropore to cover the dressing. What a lock. This is how we have secured the dressing properly. We will make sure that it will not come out for the next 48 hours, and it will not also trouble the patient on the toes, or while it will not trouble while walking. Thank you. So it is important to clean all the area, maintain the cleanliness. We are not supposed to introduce new infections while doing the dressings, and also the dressing should be comfortable and painless to the patient. These are the points which we should attend while doing a dressing.